the most important surgical innovations changing medicine in 2025. You know how we do it here at the deep dive, take a whole pile of research,
Uh-huh.
pull out the absolute key insights, and basically give you a shortcut so you're totally up to speed on these massive changes.
And you can trust the sources. I mean, we've ensured they've been thoroughly reviewed and evaluated by Dr. Reza Lankarani.
Oh, right.
Yeah, he's a general surgeon, the founder of the Surgical Pioneering newsletter and podcast series, and also on the editorial board of the Genesis Journal of Surgery and Medicine. So the foundation here is solid, authoritative.
Excellent. So, our mission for you today, we're going to walk you through the 15 most significant surgical innovations that are actively reshaping healthcare right now in 2025. We're talking nanorobots, holographic planning, wild stuff.
Really is.
So, what does it all actually mean for patients, for surgeons, for all of us? Let's get into it. Nagai AI and robotics revolution. Precision and extended reach. Okay, kicking off with maybe the biggest one. AI-powered surgical robots. Now, you hear robot, you think maybe it just holds tools.
Right, simple assistance.
But what's really fascinating now is how these things are actually doing autonomous tasks. They're not just tools anymore, are they?
Not at all. These are incredibly sophisticated systems.
Yeah.
It's AI combined with really precise robotics, and it's genuinely enhancing surgical procedures.
How so? Like, what can they actually do autonomously?
Well, think about it. They can perform specific tasks with amazing accuracy. Analyzing a surgery as it happens, giving decision support.
Wow.
Or like in a colonoscopy, identifying polyps, even predicting the next 15, maybe 30 seconds of the operation.
Predicting?
Yeah, and we've even hit this huge milestone, the first completely autonomous laparoscopic surgery, reconnecting pig intestine segments. No direct human assistance for that part.
That's mind-blowing. And the precision.
Astonishing.
Yeah.
We're seeing over 97% accuracy in just identifying instruments during robot-assisted procedures. Plus, they can give tactile feedback, so the surgeon can actually feel the tissue.
Okay, let's unpack that. A robot that can feel tissue and anticipate your next move, but with that level of autonomy, safety must be a huge concern.
Oh, absolutely. It's paramount. These systems have multiple layers of safety protocols built in. Collision detectors, force sensors.
Right.
They're incredibly accurate at spotting active bleeding, like 98% accurate with very few false positives. And constant hardware self-checks, built-in limits on where they can move. The surgeon is always in control, but now they have this incredibly smart assistant.
Right, an assistant that sees and feels things maybe even the surgeon can't. Okay, now let's zoom out a bit. 5G-enabled remote surgery. This sounds like pure sci-fi. A surgeon operating from thousands of kilometers away.
Well, it feels like it, but it's happening. And if you think about the bigger picture, this isn't just a cool tech demo. It's fundamentally changing access to specialized healthcare.
I mean,
It basically removes geography as a barrier. It democratizes surgery. We've seen successful surgeries connecting, say, Orlando and Dubai. That's over 10,000 kilometers.
incredible. What makes that even possible? The connection must be flawless.
It hinges on ultra-low latency networks. Think 5G. The median delay is just 73 milliseconds.
And how fast is that, really?
Well, for surgery, anything under 200 milliseconds is considered optimal. So 73 is fantastic. The setup usually involves primary 5G, but also dedicated fiber backups, dual console systems. Redundancy is key.
Right.
There was a groundbreaking study, actually. Safe liver surgeries across 5,000 kilometers. Zero network drops. It just means top specialists aren't confined to major city hospitals anymore.
Okay, so from connecting surgeons across the globe to incredible detail work, robotic microsurgery systems, sub-millimeter accuracy, what are these systems bringing to the table, like the Samani system?
These are revolutionary for delicate work. Why? Because they completely eliminate the natural tremor we all have in our hands.
Ah, right.
And they offer motion scaling, meaning a larger hand movement translates into a tiny, precise movement, anywhere from 7 to 20 times finer control. Plus, they use these special wristed micro-instruments that can move in ways human hands just can't in tight spaces.
So it's like giving the surgeon super steady, super dexterous miniature hands.
Kind is, yeah. You have two robotic arms controlled by the surgeon using these forceps-like manipulators. Their natural movements get translated into these micro-actions.
And where's this making the biggest difference?
Think really delicate stuff. Vascular anastomosis, connecting tiny blood vessels, lymphatic surgery, free tissue transfers, nerve repair. Really complex reconstructive work like deep nerve injuries.
Right.
And you can do it all through much smaller incisions. Studies show the results, like vessel patency, are just as good as manual techniques. But importantly, it reduces surgeon fatigue, especially in long operations. And the learning curve can actually be faster for surgeons, even if the first few procedures might take a bit longer. 2. Enhanced visualization and planning. Seeing the unseen.
Okay, so we've got robotic precision down. Now let's shift to how surgeons actually see inside the body. Augmented reality, or AR, surgical navigation. This sounds like giving surgeons X-ray vision or something.
It's kind of like that, yeah. It brings this incredible precision and a enhanced visualization right into the operating field. Take the Vision spine system, for example.
Okay.
Surgeons wear an AR headset, and it overlays a 3D model of the patient's spine, pulled from intraoperative data directly onto their view. And this model moves as the surgeon moves their head.
So it's like a transparent map laid right over the patient.
Exactly. It projects holographic images, notes, even virtual instruments onto the patient. Surgeons get instant access to scans, photos, data, all without looking away at a separate screen.
That must improve focus immensely.
It does. And studies show the accuracy is comparable to traditional navigation systems. Surgeons report being really happy with the image quality, the accuracy of where the virtual objects are placed. It's about merging that digital info with physical reality seamlessly.
Huge benefits then. Less radiation from fewer scans, better spatial sense, more precision. But it's not just during surgery, right? What about planning before? That's where holographic planning comes in.
Absolutely. Think of holographic surgical planning, like with software called CarnaLife Hollow, is taking that visualization to the next level, but for the planning stage.
Okay.
It takes standard CT and MRI scans and turns them into interactive 3D holograms. Surgeons put on a headset, maybe like the HoloLens 2,
Uh-huh.
and they can see this real-size hologram of the patient's anatomy. They can even overlay it directly onto the actual patient to see how things line up. It's truly immersive planning.
How do they interact with it? Just look.
No, it's fully interactive. They can manipulate the hologram with hand gestures, use voice commands.
Mhm.
It's hands-free. The system even adjusts the hologram's position automatically if the surgeon moves.
That sounds incredibly useful for complex cases.
It is, and it actually saves time. Data shows
Mhm.
it can cut down intraoperative preparation time by about 14 minutes per surgery because the planning was so thorough. Surgeons can really visualize tricky anatomical relationships and figure out the best approach beforehand.
Makes sense. And rounding out this visualization piece, AI-enhanced surgical imaging. So using AI to make the pictures themselves better.
Exactly. It's using machine learning algorithms to power up imaging systems, giving surgeons unprecedented clarity and precision.
How does that work?
Well, computer vision can process surgical images with really high accuracy, over 92%, for identifying steps in a procedure. It uses deep learning, convolutional neural networks. Basically, it crunches huge amounts of data from MRI, CT, even live video feeds from the surgery, and turns it all into incredibly detailed 3D models, or uses it for real-time analysis.
What are some key examples of where this is used?
Okay, so automated polyp detection during colonoscopies, like we mentioned with the robots, real-time assessment of tissue damage, validating surgical steps as they happen, even tracking instruments to avoid collisions.
So it's like an extra set of eyes.
A very intelligent, tireless extra set of eyes.
Yeah.
In robotic surgery, it helps optimize tool paths, performs autonomous tissue retraction. The accuracy figures are impressive, like 97% success in spotting potential damage to renal arteries, catching liver metastases that might have been missed. It's about spotting subtle things faster, predicting potential issues. 3, smart materials in integrated environments, beyond the traditional.
Okay, this next one, this is where it gets really interesting for me. Custom tools, made on demand, saving money, quick design tweaks, 3D printed surgical instruments. This feels like a fundamental shift.
It really is.
Yeah.
It changes the whole manufacturing and supply chain model for surgical tools.
How does it work? Just print them out.
Pretty much, yeah. You start with computer-aided design, CAD software. Then you print the designs using special biocompatible materials, medical-grade polymers, sometimes titanium.
And the cost difference you mentioned.
It's stark. A traditional set of stainless steel instruments for a procedure might cost, say, USD 50,000. 3D printed alternatives can offer huge savings. Makes high-quality tools way more accessible, especially maybe in lower resource settings.
What's the big win for surgeons and hospitals beyond cost?
Agility. The ability to quickly modify a design based on feedback from a surgeon. You can have a new iteration ready in days, not weeks or months.
Wow.
So hospitals can move away from these huge, expensive trays of instruments they might only use a few tools from. Instead, they print procedure-specific tool sets, custom tools for unique patient anatomy, or a specific challenging case. Much faster, much more affordable. And it cuts down on sterilization and inventory costs, too.
That's huge. Okay, next up, smart surgical sutures. Definitely not your standard stitches. These have sensors. Therapeutic materials.
That's right. Think of them as tiny, implantable monitoring systems woven into a thread. The tech often combines medical-grade silk with conductive polymers that can respond to wireless signals.
So they talk to the outside world.
Essentially, yeah. They incorporate tiny, battery-free electronic sensors and need a wireless reader nearby. Some even have special coatings to minimize immune reactions so they can stay in and work reliably for longer.
So what are they monitoring? What can they do?
A lot, actually. They can monitor how well a wound is healing, check its integrity, detect things like gastric leakage in real time after surgery, track tiny movements in the tissue as it recovers, and some can even deliver medication directly to the wound site.
Deliver drugs?
Yeah, they've shown promise treating inflammation, and some designs can kill nearly all drug-resistant bacteria within hours just using body heat. They typically use RFID technology to send data out maybe up to 50 millimeters deep in tissue to a smartphone or computer, monitoring pH, temperature, giving doctors this continuous stream of data about healing.
Incredible. Okay, and then we have biodegradable surgical materials. Stuff that just dissolves. No need to take it out later.
Exactly. This is a big step forward for patient comfort and reducing complications.
Yeah.
You avoid that second surgery just for removal.
What are they made of?
It's a range. Natural polymers like silk or collagen, synthetic ones like PLA, PGA, common in dissolvable stitches already, but now used for more things. Even biocompatible metals like magnesium or ceramic compounds. The real trick is controlling how fast they degrade while making sure they provide the support needed for the right amount of time.
Where are we seeing these used?
Fracture fixation plates and screws that dissolve as the bone heals, vascular stents that open a vessel then disappear, targeted drug release implants, and sutures, of course, like we just discussed, some with antibacterial properties.
The benefits seem obvious. No removal surgery.
Right. Better biocompatibility often means fewer complications. Surgeons report high satisfaction. And crucially, they help the body heal more naturally by gradually transferring the load back to the healing tissue as the implant dissolves. You can tailor the degradation time from weeks to years. Long term, this could really cut healthcare costs.
Makes total sense. Okay, finally in this section, let's talk about the whole room.
Oh.
Smart operating rooms. The OR itself becoming intelligent.
Yeah, these are ORs transformed by digital integration, advanced monitoring everywhere.
What does that look like in practice?
Sophisticated video systems, panoramic cameras, microphones capturing everything about the procedure. Then AI algorithms process all that data, providing instant feedback or guidance to the team.
Feedback during the operation.
Yes. Things like real-time video analysis. Automated checklist compliance studies show this reduces violations by about 20%. Clinical decision support popping up when needed. Synchronized data collection from all the different devices in the room.
Does it actually make things faster or better?
Evidence suggests yes. Some studies show operative times reduced by up to 25% in complex neurosurgery, for example.
Right.
Now, implementing these systems isn't cheap. It requires special teams, significant investment.
Right.
Starts around USD 100,000 for install, maybe 25K a year for the analytics. But the payoff is in better resource use, better communication, and ultimately improved patient outcomes.
Yeah.
4. The frontier of intervention, pushing boundaries.
All right, now we're really pushing the envelope. Feels like we're stepping into the future. Nanorobotics surgery. Tiny robots operating at the cellular level. This is real.
It is real, and it's developing rapidly. We're talking microscopic robots venturing into places surgeons could never physically reach before, operating down at the cellular, even subcellular level.
How do you even control something that small?
Primarily using magnetic fields for navigation, guiding them through, say, tiny blood vessels with incredible precision. These things are minuscule, maybe 1/20th the size of a red blood cell.
Wow, and what do they do when they get there?
They can carry specialized medications and protective coatings, designed to release only at the target site. They're being developed for tasks like taking cellular-level biopsies, delivering drugs to very specific, hard-to-reach spots, repairing tiny blood vessels, treating aneurysms from the inside.
So incredibly targeted interventions.
Exactly.
Yeah.
Even potentially single-cell penetration for DNA manipulation someday. And a key point, they usually enter the body through natural openings or just tiny punctures. No big incisions needed. Safety, of course, is a massive focus. Biocompatibility testing, real-time tracking systems are essential.
Okay, that's micro. Now let's go macro, in a way. The brain. Brain-computer surgical interfaces, BCIs. You mentioned fewer than 40 people worldwide have these implanted as of 2025. That's incredibly niche still.
It is. It's truly pioneering work. There are basically two main approaches. Invasive BCIs, which need surgery to implant electrodes directly on or in the brain. That gives you the clearest signal with less interference. Then there are non-invasive systems, using external sensors like EEG caps. But the implanted ones, like the Layer 7 cortical interface, that has over 1,000 microelectrodes on a film thinner than an eyelash.
Incredible density. What are the medical goals here? Why connect a brain directly to a computer?
The primary applications right now are restorative, restoring speech for people with paralysis, allowing control of robotic limbs just by thinking, helping with stroke rehabilitation, essentially facilitating direct brain-to-computer communication for people who've lost other means.
The potential seems huge, but the risks.
They're significant. and carefully considered. You have short-term surgical risks, bleeding, infection, potential brain tissue damage, then long-term concerns, gaps in our experience with the tech, and even security issues. Medical teams show a lot of enthusiasm for the potential, but it raises profound ethical questions too, doesn't it? Absolutely. Direct brain-machine links. We need to think carefully about the long-term societal impact as this technology evolves, beyond just the immediate medical benefits. Future horizons, beyond today's operating room.
Okay, looking even further ahead now, quantum computing in surgery. This sounds theoretical, but you're saying it's already having an impact. Cleveland Clinic installing a dedicated quantum computer.
It's moving beyond theory. Quantum computing offers processing power on a scale that could fundamentally change certain aspects of medicine, including surgery. It enables incredibly complex simulations and real-time analysis.
It's like what kind of simulation?
Surgeons practicing highly complex procedures in virtual environments that are vastly more realistic than current VR. Quantum algorithms can help target radiation beams for cancer therapy with pinpoint precision. Model drug interactions at the molecular level. Process huge amounts of real-time surgical data instantly. Optimize intricate surgical plans, tasks that classical computers struggle with.
So it's about handling complexity and data at a whole new level.
Precisely. It can accelerate innovation by analyzing clinical trial data much faster, reduce prep time for surgery, make radiation therapy planning incredibly precise by modeling exactly how beams interact with tissue. It opens doors to designing personalized treatments based on molecular structures that we just couldn't model before.
Wow. Okay, one last area, regenerative surgical techniques, using the body's own power to heal and rebuild.
Exactly. This is a completely different approach to repairing tissues and even organs. Mayo Clinic's work reconstructing facial anomalies, limb defects is really promising.
What's the core technology? Stem cells?
Often, yes. It combines advanced biomaterials, stem cells, frequently the patient's own, may be taken from fat tissue, and special bioactive molecules that signal the body to regenerate. For example, applying stem cells to bone substitute materials to heal defects.
And the results?
Clinical trials are showing great success, like 90% success in preventing femoral head collapse in the hip using bone marrow stem cells. We're seeing applications in complex hand and face transplants, using protocols to encourage nerve regeneration, healing terrible wounds with artificial skin substitutes that encourage natural growth, reconstructing bone defects, repairing tendons and muscles.
So it's harnessing biology itself.
Yes, and patient outcomes look very good. High satisfaction rates with scar quality, functional results. Surgeons are seeing success rates over 90% in some early treatment series. It's truly about enabling the body to heal itself in ways we couldn't before. So if you pull all this together, what we've discussed today, these innovations, they all point towards a future where surgery is just undeniably more precise, it's less invasive for the patient, and it's becoming more accessible, breaking down geographical barriers.
Right.
But it's really crucial to understand, I think, that these technologies, they're here to enhance the surgeon's skills. Better visualization, better decision support, robotic precision.
Right.
They augment human expertise. They don't replace it.
That's a key point. They're incredibly powerful tools for skilled hands.
Exactly. Empowering surgeons to achieve outcomes that were, frankly, unimaginable just a short time ago.
So, thinking about all this, what really stands out to you, our listener? And maybe think about how these things might converge. AI imaging guiding nanorobots inside one of those smart ORs, planned using holograms. How could that combination reshape healthcare even more radically in the next 10, 20 years? Something to ponder.
And for anyone who wants to really dig into the details, get more information beyond our overview today, you should definitely check out the Surgical Pioneering Podcast Series application.
Okay, where can people find that?
The link is https.surgicalpioneer.codx.me. Lots more depth available there.